Hi there, Dr. Henry. I'm just wondering, this model that you have with the moderate transmission shows that we could be headed for record levels of transmission in about a month, more than 1,000 cases a day. And if we look at the previous modeling, when we were approaching that level, we saw other measures come in to try and stop that transmission. Are you considering any other measures at this time? And just wondering how you're feeling about the contact tracing that's happening at this time. Is it manageable, or are things being done differently to kind of cope with the numbers we're seeing now?
Yeah, really good questions. So we have put in some measures, looking at the models over the last few weeks, the importance of wearing masks again in those indoor settings, the measures that we're putting in place for the post-secondary and for schools, making sure that we can do that safely, recognizing how important they are, but also the regional measures that we've put in place in areas where we are seeing those clusters and outbreaks that are spreading and affecting different parts of the community, whether it's businesses being able to operate or the healthcare system. And sadly, us like across Canada, we have a very thin line of defense in our healthcare system, and it can be a small number of people that can whelm the system, as we saw in the interiors, we're seeing starting in the north. So as we're seeing with my public health colleagues, so yes, it is straining some of our case and contact management, but we are focused again on the making sure that every case gets contact. And that we understand the risk settings. So we are prioritizing risk settings, but it's not so much because we're whelmed with cases, which is part of it, but it's also because we know that some people are at lower risk now. So you're at lower risk of being infected and lower risk of transmitting to others if you are fully vaccinated. And what we're finding is the transmission chains from social interactions, from a party, for example, where we might have seen 30 or 40 people out of 100 being infected a few months ago. Now that the majority of the people in that environment are immunized, we're seeing just the unvaccinated and a small proportion of vaccinated people. So it may transmit to 5 or 6 people. So yes, we have modified some of our contact management for some of those very low risk settings, priority places, if people haven't been in group communal settings, for example. But we are committed and will continue to do case management of every single case and contact follow-up, particularly in those higher priority settings.